Good afternoon. My name is Michelle Shoresman, and I'm the designated media contact for the San Luis Obispo County COVID-19 Public Information Response Team. This afternoon, once again, we have our Emergency Services Director and County Administrative Officer, Wade Horton. I'd also like to thank all the members of the media for being here, as well as the public who are tuning in, asking questions on social media, and providing feedback on how we can make these briefings more effective. We sincerely appreciate your constructive feedback. And now, County Administrative Officer and Emergency Services Director, Wade Horton.
Thanks, Michelle. Good afternoon, Wade Horton, County CAO and Emergency Services Director. Today represents the 4th day of sheltering at home in our county, and I know this order is having an incredible impact on all of our lives. But we are taking these extraordinary measures necessary to slow the disease spread in our county. And we're doing this because we can save lives. Although we do encourage people to get outside, social distancing must be adhered to for our plan to work. That means keeping your distance from other family units at the beach, hiking, and on bike trails. We are blessed to live in a beautiful county, and we are fortunate that we can enjoy being outdoors. But we have to social distance. For this reason, the Pismo Preserve will be closed until further notice. Social distancing was not being maintained, so this decision was made to protect public health. We do not want to close additional trails or beaches, but we will evaluate if needed. We as a community have to partner in slowing down the spread of this disease, and it will take good decisions and sacrifices from everybody. We've been receiving calls with folks expressing concerns when they see non-essential businesses operating and not adhering to the county shelter-at-home order. We will be setting up a separate hotline dedicated to these calls, and that hotline will be ready tomorrow. And we'll go ahead and publish that number on readyslow.org, and I'll mention that number tomorrow's briefing. Today, our county health inspectors are visiting permitted businesses to check in on compliance. Our goal is to achieve voluntary compliance through working with the public and having dialogue, such as what we are doing right now. Although violation of our order is a misdemeanor, we are focused on partnership to protect our community. I know there are a lot of needs in our community right now, and we are working to meet them. One of those needs is blood donations. College and business blood drives have traditionally been a significant source of blood supply in our county. With college students returning home and shelter-at-home order in place, blood donations are down. Although blood transfusions are not needed to fight COVID-19, there is still a need to keep blood supplies adequate. Please consider giving blood. Our hospitals need your help. Giving blood is exempt from the shelter-at-home order, and COVID-19 does not pose any known risks to donors during the donation process. Please consider scheduling an appointment today by calling 877-827-4376. Again, that's 877-827-4376. The donation center is located at 4119 Broad Street in San Luis Obispo. Again, that's 4119 Broad Street, SLO. I want the public to know that we are working hard with Tenity and Dignity Health, evaluating healthcare system capacity. We are coordinating with President Armstrong and Cal Poly staff to assess their facilities, with the exception of dorms and residence halls, to locate an alternative care site in the event it is needed to help with potential overburdening of our healthcare system. I'd like to note that we are engaging the private sector to help with the evaluation and planning of this effort, and I appreciate their support and the offers to assist that are coming in every day. I'll now turn it over to Dr. Penny Bornstein for the public health update.
Thank you, Wade. Good afternoon. I'm Penny Bornstein, the County Health Officer for the County of San Luis Obispo. We have told you previously that we would only put all of the details of our cases online. We are here before you every day, so I will tell you what I know when I know it for the day. So we are now at 33 cases. 2 of them are hospitalized, 1 in our county still and 1 outside of our county, but both are county residents. The good news is we now can report that 3 of our cases have fully recovered, and everyone else is doing well at home. I want to remind folks, I've said it every day, but again, it's important to note that we do expect to see an increase in cases day over day, week over week, and perhaps month over month. People have been asking me, when do we see turning the tide? And that's a difficult question to answer. We've looked at other countries and their experience, but every situation is different because it depends on the types of protective measures that have been taken and when they've been started. We are hopeful in this community that the type of measures that we have taken with the shelter at home order and the social distancing that we are continuing to recommend and enforce if necessary will in fact turn the curve, but we don't know when that will be. My best estimate is that we are looking at a minimum of weeks before we hit the peak number of cases, and it may be even longer. With regard to testing, we are continuing to meet the demand for our public health lab, and I'm happy to report that we have gotten some of our newest test results from other private labs. So that tells me that not only the single lab that we were getting our positive results from is testing, but now some other private labs are now beginning to handle specimens from individuals in our county. So the lab capacity seems to be increasing. We are getting requests now from providers about their PPE needs, their protective equipment for infection control for themselves, and we are able to meet those at this time for the most part. We are short on gowns. We are hopeful that we are getting some, and we have communicated back to our providers that that is not a critical component of taking specimens. But again, healthcare providers who are looking for personal protective equipment or PPE that don't have sufficient supplies in their offices can either call us through the Public Health Department line, which will route right over to that phone assistance center, or they can go online through the readyslo.org and find their way to the healthcare provider button and push on that, and they will see a place that they can go right online to order supplies. With respect to the daycare situation, there are a large number of first responders who we need to make sure that their children are taken care of so that they continue to work. So we've been working in concert with the school system, with the EOC, and with a number of other providers who are looking to stand up and are planning to do so this week. Child care for essential workers. I've received a number of questions, well, who is an essential worker? And in this regard, we are right now looking to only provide this service to the people who are actually fighting the disease. I know that the availability of child care is a big issue for many sectors of our community, but we are providing this only for the people right now who are emergency responders to the disease at hand. We have put a call out to invite people who are either teachers in the system or otherwise do not have their regular jobs and may be available to staff these child care centers for these children of essential workers. And we're hoping that as many, especially those who are in the lower risk groups of young and healthy individuals, will make themselves available to serve that I do want to talk a little bit about the social distancing measures and the transmission of this disease. I think you've been hearing everyone now is an expert on 6-foot distancing. So why 6 feet? It is not a magic number. It is the average distance, if I can be graphic, that a cough or a sneeze generally goes in terms of the droplets. So that's why. That doesn't mean that someone passing through your 6-foot space is at risk of getting the disease unless you're actively coughing or sneezing on them at the moment that they do so. So we're asking for people to think about the infection control measures and adhere to this 6-foot distancing, but also not, we're beginning to see a number of calls where, hey, I saw people on bicycles that were less than 6 feet apart. What I've been saying throughout this whole epidemic is we are invoking all of these stringent measures to bend the curve, to bring down the curve, to limit the spread, but we are not anticipating that every fleeting interaction between human beings is going to be a source of transmission. So I ask the public to just use reason in trying to engage and adhere to, as you heard Ms. Doreen say, consistent social distancing. But we also want to balance that with not hearing every time there may be a mother and a small child taking a walk on the beach. So I just want to put that kind of messaging out about what social distancing means, what our best efforts are, but to ask for the population at large to think about what the conditions are for adhering to that, and in some cases what they are not. So, for instance, we're getting requests about shouldn't we do away with people being able to bring their canvas bags into grocery stores because might that not be a source of transmission? My answer is there's a very small I can't say to you with straight eyes and an honest heart that there is no chance whatsoever that couldn't be a source of transmission. But what I can say is that is an extremely low likelihood situation. And so that is just one type of example. Or I'm playing a game of tennis with my best friend, and we're on opposite sides of the net, so we're doing social distancing. But what about the tennis ball that I've just hit that now my partner goes and picks up and sends back to me for that fleeting second that they're holding it in their hands? That is not a dominant nor effective means of communicability of this disease. So I give you those examples so that we as a society can continue to find the balance between doing the right things, adhering to the measures that we've put in place, but also continue to have some measure of life while we are going through this together. As a public health officer, I ask for people to continue to get exercise. I ask for people to continue to get outdoors, to continue to get the groceries that they need at the grocery store, to go and get the gas that they need to go to places, and to do as much as is possible with respect to wiping down surfaces and keeping your distance. But we also have to understand that we cannot eliminate all interaction or all 100% possibility of a single germ living on a tennis ball or on a canvas bag. So with that, I understand, I totally understand that people are scared, but I offer these kinds of examples as a way to ratchet down just a small bit the amount of panic that people have with respect to continuing to live our lives. And with that, I'm going to turn it over for questions.
Dr. Borenstein, I noticed there's a positive case, another one under the age of 18 or 0 to 18. Is there any information you can provide that individual?
I don't have that information at this time.
Okay, and then also in regards to daycare, how is social distancing observed with that type of situation?
Right. No, yeah, that's a very good question, and it goes to the point I'm trying to make that we are going to do our absolute best within the framework of our best response to this outbreak, this pandemic. But we can't empty our hospitals of healthcare workers because they have to be home for child care. So the better part of Valor is providing child care in situations that can allow our most important emergency responders to continue to do the job that they need to do in taking care of the patients with this disease. That said, within a setting of child care for their children, we are going to do our absolute best to monitor that those children remain disease-free, to keep them as well separated as we can, especially for the staff who are at a higher risk potentially because of their age or condition, which is why I asked that especially younger and healthier individuals populate the staff of those centers. But we are not in a position to both respond to this disease effectively and avoid 100% opportunity for transmission of disease. Thanks.
I have a question. Oh, I have a question. Are you able to tell us how many tests the private lab can administer?
We've been working on getting an update to that number, but we have been unable thus far.
And then another question: is there like communication between the counties? So, a student from Cal Poly were to go to the Bay Area and test positive for COVID-19, would we get that information here in SLO?
Yes, counties share information amongst ourselves as to where the resident county is.
And then have there been any citations issued for people not complying with the shelter?
Not to my knowledge.
Not yet.
And then also, would you be able to give a little bit more information on would the Cal Poly dorms be used for any type of hospitalization? Is there any update with that?
Do you want to address?
As I mentioned, we are working with President Armstrong and his staff to assess the site, but no, dorms will not be used for an alternative part of the alternative care site response. Dorms will not be used.
Have the formal health sites been identified yet that would possibly house the homeless?
Yeah, we have a hotel in Atascadero with 27 rooms. We have a hotel in Morro Bay with 45 rooms. We have a hotel in Pismo Beach with 22 rooms, and then a hotel in SLO with 61 rooms.
The trailers that are delivered, I checked on Friday.
Yeah, they were delivered Monday morning. Yeah, today's Monday. That's right.
Also, Wade, with the closing of Pismo Preserve, you said there could be potentially other closures, other spots that are being flagged right now as potential candidates?
Not right now. I had a very good conversation with the Land Conservancy last night regarding Pismo Preserve, and it was a very difficult decision. However, as Dr. Bornstein mentions, we do want to get people outside. We do want family units to be together and to be able to enjoy the outdoors. But in this specific case, that parking lot and the restroom area, there were folks that just weren't minding that social distancing requirement, so we had to make that decision to protect public health.
Does the 18,000 students that come back to move out of the dorms concern you or anyone else that they went to Seattle, they're back to their communities? Are they asked not to come back and move out?
Well,
or housing, even housing.
So the question is, the Cal Poly kids that moved out, what happens when they come back? My understanding from Cal Poly is that they're going to be moving forward with distance learning. So that's not something that we're looking at as a high risk at this point, but we can evaluate that in the future if needed.
Any additional questions? Okay.
Thank you.
Thank you again to all of you for coming today and for the public for tuning in at home. Just a few reminders again to close. All of our case statistics, media releases, guidance documents, fact sheets are all being uploaded pretty much real time on readyslo.org. We also still maintain the phone assistance center line. That's where you can talk to a live person if you have questions about any of the information that you've heard or seen. That number is 805-543-2333. 2444, and that's open 8 a.m. to 5 p.m., 7 days a week. We also have the public health information line that is a recorded line that's available 24 hours a day, 7 days a week, and that number is 805-788-2903. Lastly, and most importantly, starting tomorrow and through the rest of this week, viewers can tune in live on the San Luis Obispo County Public Health Department Facebook feed to these media briefings at 3:15 p.m. It's also being streamed live on KCOY and KSBY websites. Thank you, and just remember that from this point till the end of the week, we'll be doing these briefings at 3:15 instead of 3:30. Thank you, and have a great afternoon.
Okay, San Luis Obispo County medical and health officials updating the public, reminding everybody this is day 4 of sheltering at home. The current cases of COVID-19, 33 confirmed cases. We've got 2 people hospitalized. 3 people have fully recovered. The remainder are in their homes, and they are doing well, according to the update today. New today, the Pismo Preserve will be closed until further notice. That is because of a lack of social distancing that was recognized and observed over the weekend, particularly in the parking lot and the restroom area. So that, again, Pismo Preserve will be closed until further notice. Also new, this is starting tomorrow, it will be the launch of a new hotline. This is for people to report businesses and others who are not complying. So you can find that information at the ReadySlow.org, and we have that information on our website as well. And also updating folks on the social distancing, saying that 6 feet is, it really is a magic number, because that is the distance in which a cough or a sneeze droplet can fly, for lack of a better term. So that's so important that people continue to keep that 6 feet between you and the person who you're near. But they also said you don't need to be calling in and reporting every single person who you see who is not at that 6 feet. So it sounds like they're getting inundated with that as well. So this launched hotline happening tomorrow will help them kind of parse out those who really are not complying on a larger scale. Also, the need for blood, that's huge right now. Vitalant is actively participating, asking people to make an appointment. I've got that number for you. Grab a pen and paper. It's 877-827-4376. You can call and make an appointment. Again, this is for Vitalant, 877-827-4376. This is at 4119 Broad Street in San Luis Obispo. Also looking at alternative care sites. It sounds like there are a number of hotels. He was kind of slotting off the different hotels that are going to be working with the private sector and assigning for alternate care sites to help with the healthcare capacity if that need does arise. They are not going to be using dorms, was one of the questions that was raised, and that's not going to happen. Also, Penny Borenstein, the county health officer, saying that it's going to be a minimum of weeks before we hit the peak with this COVID-19 pandemic. Also, testing lab capacity is increasing. That's thanks to private labs along with other labs that are already online within the county. The need for PPE, the personal protective equipment, is still there, particularly the gowns that are being used during this in hospitals and in clinics. Also put a call out again for daycare. This is specifically for the first responders on the front lines helping fight the disease. These are essential workers that are needed in the hospitals. Their children also need to be taken care of, so they're going to great measures to make sure that those children are absolutely kept away from the disease. It's a big need right now, so people who are in the school system coming out, trying to help in that way, people who are in the daycare industry as well, also coming forward to help our essential workers do their jobs and make sure that their children are being looked after. A couple of phone numbers that you already might have, but in case you don't, they're so vital for you. So again, you want to get a piece of paper, write this down. This is that live in-person phone number that you can call from 8 in the morning until 5 in the evening. Area code 805-543-8255. 2444. That website, readyslow.org, for more information. And then that 24-hour recorded number is 805-788-2903. And we'll have full team coverage of the impact of the coronavirus that it's having on the Central Coast. That's coming up tonight on News Channel 12 at 5 and 6 o'clock. We'll also continue to carry these news conferences every day live in their entirety. Again, a reminder, tomorrow's is set to start at 3:15. You can watch on air and online. And we do have a special section on our website dedicated to the coronavirus where you can read the very latest updates and find local resources. Just head to our mobile app or KCOY.com/coronavirus. We'll also be back around 4:30 for Santa Barbara County's news conference. We'll see you then.